Hello, and thank you for listening in today. My name is Jason Phelps. I'm a senior clinical consultant for OFMQ. And today we're going to talk about modified stage 2 in the meaningful use program for hospitals. In both 2017 and 2018, hospitals can choose to attest to either modified stage 2 or stage 3. This is going to depend on which version of the EHR you're using, whether it's 2014 certified or 2015 certified. If it's 2015 certified, you can choose to do either one. If it's 2014, you're going to have to do the modified stage 2, which is again going to be the focus of our conversation today. So we're going to go ahead and jump right into the objectives and measures for modified stage 2. Hospitals are going to have to attest to a single set of objectives. There's 7 different objectives that you're going to have to attest to. They include protect patient health information, e-prescribing, health information exchange, patient education, MedRec, patient electronic access, and public health reporting. The first one is protect patient health information. What this one is basically doing is requiring your organization to conduct or review a security risk analysis. This is required by HIPAA and is also required for programs like the Meaningful Use program. The first step of this measure is going to be actually conducting the risk analysis. The second part is that you are going to have to actually address those risks and mitigate some of those risks. So if you turn in a blank risk analysis, you're not going to get credit or pass this objective. You're going to need some additional documentation showing that you've actually done something. This risk analysis can actually fall outside of your 90-day reporting period, but it has to be unique for each reporting period, and it has to be conducted within the calendar year. So it can fall outside of that reporting period, but you are actually addressing the information that is occurring while that reporting period is going on. This is a sample of one of the risk analysis tools that we use at OFMQ. You can see that it's got the different standards that are tied into the HIPAA risk assessment. You can see it shows whether you're compliant on a risk, what the likelihood that a risk is going to occur, the impact if a risk does occur, and then it's going to give you a score based on that. It's also got sections within the tool to show what controls that you've implemented as an organization, the date that you've addressed that, and so it's got room for you to show the improvement and the things that you've done to change and address these risks that you find during the assessment. So this risk analysis one is going to be a yes/no. You're just going to attest yes or no to whether or not you performed one during the reporting period as far as meaningful use is concerned. The next objective is electronic prescribing or e-prescribing. For this measure, more than 10% of your hospital discharge medication orders are going to have to be queried for drug formulary, and they're going to have to be transmitted electronically using your EHR. That first part is important, the drug formulary, so you do have to have a drug formulary in place and check the patient's formulary before prescribing the drug. And then the second part is actually sending that drug electronically. There is an exclusion that if you don't have an internal pharmacy or if you are in an area that doesn't have a pharmacy within 10 miles that accepts e-prescribing, there's not a lot of people who are going to fall into that exclusion. I know a lot of hospitals have internal pharmacies, but that exclusion is available if you are in a really, really remote area. The third objective is health information exchange. So this was also, you'll hear it called summary of care. So if you hear summary of care or health information exchange, that's really talking about the same objective or measure. So this is going to be for patients that you are sending from your facility to another place to be treated, or you're maybe sending them from your facility, discharging them back to the care of their primary care provider. So for this objective, you have to first of all use your EHR to create a summary of care document. And then the second part of this is that you have to electronically send that document to the receiving providers more than 10% of the time for your transitions of care and referrals. So this is an example of a summary of care document and what all has to be included into that document. Your EHRs are going to have this built in and have a lot of these fields pre-populated from the note or different sections within the chart. I do want to put this up here, though, to point out that there are 3 required fields outside of patient name and some of those general demographic things. But the 3 items that cannot be left blank are the problem list, medication list, and medication allergy list. So if you remember way back in stage 1 meaningful use, you were being basically scored on keeping up with these different lists. And now you're seeing that come full circle with some of the new modified stage 2 and stage 3 measures that are out there right now. So those 3 fields do have to be populated within a summary of care document. Again, whenever you're sending that document to another provider of care. And just a little bit more about health information exchange. So this refers to the act of exchanging health information. A lot of people, I think, nowadays may associate an HIE with an organization or an entity. And so this is really talking about the act of that information moving from one place to another. You have to have reasonable certainty that the receiving provider actually did receive the document or has the capability to go grab that document if it's being stored somewhere electronically. Acceptable transmission methods for health information exchange include a secure email, a health information service provider or a HIS, query-based exchange, or the use of a third-party HIE or health information exchange. Basically, the only stipulation that they have is that the exchange must comply with the privacy and security protocols under EPHI for HIPAA. So again, that's going to tie back into your security risk analysis and just make sure that you're following some of the rules about the security of data on the move. In cases where a provider does share access to an EHR, so this is really going to be some of your bigger groups. If you have a multi-specialty group, so you have primary care providers and specialty providers all under the same roof using the same EHR, same database, you have the option of choosing to count those transfers of the patient as a transition of care, or you can choose not to count them. The only thing you have to do is make sure that you're uniform on the way that you count those towards this measure. So if you count one, you're going to have to count all of those. And again, that's just people who are using the same system and same database, but transferring to different specialties within that same group. The fourth objective is patient-specific education. So this measure has been around since stage 1 meaningful use as a menu objective, still around in modified stage 2. So you're going to have to use information from your EHR to identify what type of education a patient may need. And then you're going to have to provide those that education to patients, at least 10% of them, during the reporting period. So that's going to be 10% of all your unique patients that came into your emergency department or in as an inpatient. Again, you don't have to use information or patient education out of your EHR. You can use other resources, other websites, other electronic media. You just have to have your EHR identify what type of information the patient's going to need, whether it's based on a medication they're taking or a specific disease or diagnosis that they may have. The fifth objective is medication reconciliation. This one is, again, a menu objective that's been carried forward, and this is kind of on the opposite end from summary of care, but still dealing with transitions of care. So if you remember talking about the summary of care, that's all of your outbound transitions of care, so people that you're referring or transferring out. The medication reconciliation is going to be for all your inbound transitions of care. So anyone that you're receiving from another facility, another healthcare provider, make sure that you perform a med-rec on at least 50% of those patients that come in as transitions of care. So this is going to be taking that medication list that you're getting within that CCDA document, and comparing it to the medication list that you have on file within your EHR, making sure there's no duplicates, making sure there's no harmful interactions or allergies to any of the medications that are on that medication list. So again, you're going to have to compare those med lists, perform that medication reconciliation for at least 50% of those inbound transitions of care. The sixth objective is patient electronic access. So this objective is going to have two different measures within it. They're basically wanting you to provide online electronic access to patients, and you have to do that within 36 hours of hospital discharge. The first part of this is just providing the access to the patient. So at least 50% of the patients that come in during your reporting period or are admitted are going to have access to their information online somehow. The second part of this is going to be patients who actually do something with that data. So once they're discharged, are they actually getting online and looking at things? There is an exclusion for the second measure. This is going to be if you're in an area that doesn't have sufficient broadband access. You can go to broadbandmap.gov and look up some information about your county and see if you qualify for this exclusion. I will just say that there are not very many counties nationwide that do qualify for it, but if you're, again, in a very remote or rural area, this is something that you may want to look into. So to talk about these a little bit more in depth, again, the patient electronic access objective has two different measures. This first one, provide patient access, is dealing with you just making that information being available to the patient. So again, the threshold for this is 50% of the patients that come in during your reporting period. For this one, you can give access to these patients in a variety of different ways. Your EHR may set it up to where you enter an email address and then it sends them a link to sign up for the portal. You may be able to create a token or a secure key and give that to the patient so that they can just take a code or a number and plug it in on a website and get access that way. So however your EHR offers that access, that should work for this. What does not factor into this specific measure is patients actually using it. So for this one, as long as you give access, say you've given access to 75% of your patients, but only 2 people have logged in and used it, that doesn't affect this measure. That applies to the second measure. So the second measure is view, download, or transmit. So for this measure, the threshold is not 50% like it is with the other one, but just one patient. So what this is saying, broken down, is basically one patient has to log into your patient portal and do something with that data. Look at the information, download it, just log in and do something with that data. Again, the broadband exclusion does apply to this measure. It does not apply to the first measure. Oh, and patients do have to access the data within the calendar year to receive credit. So let's say your reporting period was the second quarter of 2017. Whatever patients came in during that time period, if you gave them online access whenever they were discharged, they have until the end of the year to log in and you still get credit for that. So even if it's November and all of a sudden they decide, oh yeah, I can log into the portal and see some information about my hospital stay, that will still get you credit as long as it occurs within the calendar year. The seventh and final objective is public health reporting. So for this one, the hospital has to be in active engagement with the public health agency to submit electronic public health data. You have 4 different measure options, and you're going to have to choose 3 of these 4 measures to attest to. The first one is the immunization registry. The second one is syndromic surveillance data. The third, a specialized registry reporting, and then the fourth is electronic reportable lab results. I will tell you that in Oklahoma, we do not currently accept syndromic surveillance data electronically. So the state does not have any plans to stand up that type of registry, so that's not going to be an option. So you are going to have to rely on the other 3 measures to be able to attest for meaningful use. There's a couple of different things that they can mean by active engagement. So what they're trying to do here is just make sure that you have reached out and connected with your public health agency, and that when they're ready to submit data, you're going to participate and start sending data. The first option is completed registration to submit data. So if you complete registration but the state was not ready to do anything, they didn't have their system in place, they couldn't accept data, that's fine. You can still attest yes to this objective. The second option is that you have registered with the state. You're in some form of testing with the data. So maybe you sent them a couple of test files, but you don't really have that live connection in place. This, again, is also acceptable and gets you a yes for the measure as well. The third option is production data. So this is where you registered, you've done all the testing and validation, you're actually connected to the state health department, and you're sending them live immunization data. So obviously if you're doing that, you're going to be able to say yes for this objective as well. But just know that there are different layers of this active engagement that kind of give you a little bit of a pass depending on where the state is at in their process. This is the website that you can go to. Hopefully everybody is registered, and maybe you just need to go update your registration for this year, but you can go here to OSDH's Meaningful Use website. You log in, you just make sure that your reporting periods are up to date, make sure that you have checked the boxes to submit data for immunizations and the lab reportables. And then we also have a link to another specialized registry. You can do, if you do any form of electronic case reporting, that would qualify. Or the CDC has national healthcare surveys. So you can click the link there. It'll take you to their national healthcare surveys page. Find the one that's for hospitals and fill that out and submit it. And they have gotten approval for that to be considered a specialized registry for meaningful use. So that can get you your third public health objective if you're needing that for meaningful use this year. Back to the OSDH real quick. If you do have any questions or issues with logging in, maybe you can't remember a password, you can email them at meaningfuluse@health.ok.gov. And they're really great about getting back to you quickly, doing password resets, making sure your organization's set up all properly. So they've been a great resource to reach out to if you're having any issues there. And then this is just, again, that CDC Healthcare Surveys page I was talking about. So this is their Declaration of Readiness for Public Health Reporting. So that's kind of what shows you that this will qualify for meaningful use. So again, you'll just click on the National Healthcare Surveys. You'll scroll down over here and find the hospital section, and then complete that survey. And that will get you credit for your third objective or third measure if you're needing that for public health. So just to kind of wrap things up, those are the 7 different objectives for Modified Stage 2. Again, some of these objectives are going to have multiple measures within them. There's 2 different parts or 2 different things you have to attest to, so just be aware of that. We will hold additional webinars later on discussing Stage 3, some program timelines and requirements and different things like that as well, and going a little bit more in depth on some other topics. The one last thing that I want to remind you is that you're collecting all this data that we just talked about, all of these objectives and measures. You're collecting data on them throughout the year. You have to collect data for a minimum of 90 days in 2017, and then you're going to have until the end of February in 2018 to report that data to CMS. So just remember, you're collecting data in 2017, your measurement period, and then you're going to have to submit that data to CMS after the first of the year. Thank you again for joining us today. If you have any questions, feel free to shoot us an email, give us a call, or visit our website for just some of our different service lines, different events that we have going on. And again, thank you for joining us, and we look forward to having you again.